Hello, everyone, and welcome to the webinar learning about a new FDA-approved non-drug treatment option for painful diabetic neuropathy. My name is Petra, and I work at Nevro, the medical device company and creator of HFX and the host of today's presentation. While HFX can treat other types of pain, such as back pain, today's presentation will focus on the use of HFX for the treatment of painful diabetic neuropathy. Before we start, I want to mention that you don't need to worry about trying to take notes on everything that you're going to see today. As a follow-up, we'll be sending an email within 24 hours, including a recording of today's presentation, as well as some of the key links and next steps that you'll hear about in today's presentation. Our live Q&A will be at the end of the presentation with Dr. Petersen. As a reminder, and just to let everybody know, you can submit those questions by clicking on the Q&A only, as you can see here circled on the image. Type your comment right where it says type your comment, and then if you're on your phone, you can hit return, on your keyboard enter, or you can click on that blue arrow right next to where it lets you enter your comment. What the top two questions that we always get and that I find helpful to answer just off the top of the presentation so that you can then kind of sit in and relax and absorb the information are, where can I get HFX and is it covered by insurance? So HFX is offered by thousands of physicians across the US and we'll provide information in our follow-up and at the end of the presentation on how you can find a physician near you. And HFX is covered by all major insurance plans, including Medicare and Medicare supplemental plans, Medicaid, and the VA and TRICARE. And without any further housekeeping, I do want to just introduce Dr. Petersen. She's a board certified neurosurgeon with her research is focused in treatments for chronic pain using neuromodulation. She works at the University of Arkansas Medical Sciences Department of Neurosurgery, and her medical degree is from the University of North Carolina School of Medicine, and she completed her fellowship at the National Hospital for Neurology and Neurosurgery at the University of London. Welcome, Dr. Petersen, and thank you for leading today's presentation.
Thank you so much, Petra, and thank you to everybody who's joined us. And just so you know, this is being recorded, so there is the opportunity to go back and review or to watch this at a delay or even share it with somebody that you know. So we hope that you'll take the opportunity to stick with us and share this with some other people who can benefit. One of the things I think is really important to say is that I'm a neurosurgeon. I do a lot of brain surgery and spine surgery, but I'm really motivated to help people with chronic pain. And part of that is to look at what we can do using small procedures and sometimes bigger surgeries to address pain in a way that does not require opioids or other medications. This is what led me to do research in painful diabetic neuropathy. We know that this is a large group of patients. We know that there's a lot of medications that can be tried, but often those medications have side effects and they often don't work for patients. And so there's really a need to do something more to help people. So the worries that you have are some of the quotes that you see here. People who can't sleep through the night because pain wakes them up. They've got to get up and pace the floor, rub their feet, or even just having the sheets graze across their toes is enough to start shooting in sharp electrical pains and stabbing. There are medications that people try that have real bad side effects with. They make them drowsy, they make them cranky and have mood problems, or they're really unaffordable. And if they're not really helping that much, why keep going on additional medications, particularly when a lot of people already take medicines for diabetes or for other medical conditions on top of it. So the other piece of that is how limiting pain can be in terms of the day-to-day of life. People who want to get out there and do things, and pain is a barrier to doing the stuff like playing with their grandchildren and having to turn down social life or even work opportunities because of the fact that the pain is in the way. So there's a real motivation with what I see within my patients to do something about it. So first of all, what causes painful diabetic neuropathy? Well, diabetic neuropathy is one of the main complications that comes with diabetes. It's related to the high sugar levels, causing injury to the nerves within the body. Most typically, those are the long ends of the nerves, which is why we see it first in the toes and the feet and in the hands, is because those are the areas of those nerves that are furthest away from the spinal cord. That nerve damage pain can progress and come up further, but we really see that can be feet area first of anything. And even with good glucose control, even with healthy lifestyle and doing everything else right, diabetic neuropathy, foot pain can happen. How does it feel? A lot of people talk about pins and needles, sharp shooting pains, burning, fiery pains, creepy crawly ants, like stamping on a bunch of fire ants. All of those sorts of sensations can be there. And with it also a lot of times numbness or even painful cold feelings or painful numbness. So this is what we look for in terms of what we can treat when we're trying to, first of all, diagnose, does a patient have painful diabetic neuropathy? So how do you treat it? Well, there's things that are topical, things like capsaicin ointments, for example. There are prescription medications like gabapentin or pregabalin, other medications that you may have seen like Effexor, duloxetine, amitriptyline, and then finally pain medications in the opioid category like oxycodone and hydrocodones. But as I mentioned, there are limitations to those, including side effects and the cost of refilling those medications and interactions with other medications that a patient may be taking. And that on its own may not be enough to take the medication in order to get a return on that. So that's why I'm really glad that you're here listening to what this other option is. HFX is a system which is non-pharmacologic to treat pain from painful diabetic neuropathy. The research that I helped to lead here through the University of Arkansas led to the FDA approval of this device to treat painful diabetic neuropathy, to control the sorts of pain that it really is limiting in terms of activity, limiting in terms of sleep, affecting of mood. This isn't something brand new. It actually came from a population of patients that I've treated for a long time, which is people who've had previous back surgery who after their surgery have leftover back and leg pain. And that is a chronic nerve damage related pain related to having persistent injury no matter whether they had a successful surgery or not. So we know from that patients do well with using the small stimulator HFX device to help decrease back and leg pain. And coincidentally, some of the patients who were having their back and leg pain treated also had neuropathic pain from painful diabetic neuropathy. And they would tell us, I think that burning pain is better also. And so we know the HFX device has been used for 90,000 patients or more worldwide. It's been FDA approved in the US since 2015 and been used globally for more than 12 years. And therefore, it's safe and effective for chronic pain. The research that we did specifically looking at painful diabetic neuropathy was focused to show how effective and safe it would be just for those patients with PDN. So how does it work? The short version of this is I would describe it as a pacemaker for pain. There's a small implanted box underneath the skin which has a pulse generator. It sends these little electrical impulses under the skin through tiny wires that go into the back of the spinal canal. Those impulses are designed to disrupt the usual messages of nerve damage. Think about it. Damaged nerves don't know what to tell the brain other than I'm damaged, I hurt, I'm damaged, I hurt, I'm damaged, I hurt all the time. And if you can jam that message with a small signal from this pacemaker for pain device with HFX, then what you're able to do is quiet that message so that people can get a degree of peace and quiet in their own bodies. 9 out of 10 people who use that stimulator to take care of painful diabetic neuropathy in our research reported they were satisfied or very satisfied using the HFX device to address their pain. In addition, what kind of pain relief do people get? Well, on average in the research, these were people that when you asked them on a 0 to 10 score, what was the severity of their pain? 0 is no pain, 10 the worst they can imagine. They had a pain level on average of about 7.6. And that is constant, everyday, day-to-day pain. What we were able to do is see an average decrease in pain from that 7.7 to a 1.7. And not only that, but the pain level stayed low after 2 years of treatment. A lot of people take medication and they may get benefit for 3 months, 6 months, something like that, and then it stops working as well. So the idea to think about the fact that this is something that we can show durably continues to work 2 years after a patient gets the device and is still using it. And you would think that maybe during that time, they're still suffering with diabetes and the complications. Maybe their nerves are just trying to hang in there and hopefully not get much worse, but we're actually seeing a stable control of pain for that time. So 80% of people had more than an 80% reduction in pain in our research. When pain is better, you think that other things probably go better along with that. Sleep quality, for example. People experience longer sleep, less disruptions in sleep, better overall rated quality of sleep because of the pain control that the HFX device provided. Additionally, this was really interesting. Some of those people that talked about feeling numbness in their feet, having difficulty feeling the floor underneath their feet, some of those people noted that they could feel the floor better. And we did a physical examination checking to feel how people could sense touch on the soles of their feet. And we found that about 60% of people actually did have improved perception when we were looking at that in the office during our research study. Finally, as you expect with sleep and pain being better, mood, quality of life, engagement in day-to-day activities, all are better for people after the HFX device in our research as well. So who's a good candidate for using an HFX device? Well, this is specifically for painful diabetic neuropathy. So we want to make sure a patient is diagnosed with diabetes as the explanation for their neuropathic foot pain. We want to make sure that they're diagnosed with painful diabetic neuropathy, and typically that's something that's done through physical exam and through an interview to make sure that the kinds of symptoms the patient is experiencing line up with the diagnosis. The other thing is that because the device is a small pacemaker and requires a small surgical procedure to put it into the patient, we'd rather be sure that a patient doesn't respond with something a little bit lower risk, like a trial of medication, before they have a procedure. So in general, people should have tried at least 2 categories of medications without a good long-term response. In our research, what we found is that about 5% of people, if they tried a better medication, might have enough of improvement in pain, but ultimately those that didn't respond went on to have a stimulator device that helped them quite a bit more than that. So how do you try one of these devices? Well, one of the things that's important is to know that this is something that before it's implanted permanently, we do a temporary test drive. In order to get to that stage, you can go to the website hfxforpdn.com, do a short assessment questionnaire to see if you fit the category that this might work for you or someone that you're thinking of for this. The other part is Nevro HFX provides links to the care team so that they can provide you information if you have questions, and they can also connect you to an HFX trained clinician in your area. That doctor can then consult with you and look at your personal situation, medical history, and answer all your questions about HFX and whether this is the right next step. Once you and your HFX doctor decide that this is the next step, then we recommend a temporary test drive. And this is something I do for all of my patients who are considering a spinal cord stimulator HFX device. What we do is thread the wires temporarily into the spinal canal, kind of like how somebody might have an epidural catheter for labor. And they come out through the skin, taped down with a little temporary control box to test the device. You wear that home from the procedure and try it out for about a week. In that week, I want to see how much pain reduction does somebody experience? Are they able to sleep better? Can they walk a longer distance? Are they able to stand better without pain? What else is different? And at the end of the week, we take the tape off, we remove the temporary test wires, and we take the decision together. Was that test drive worth putting in a permanent device? Was it worth going ahead and getting the HFX implant for good? About 90% of patients choose to go forward after having a successful test trial, but it really want to make sure with you and your doctor that it's the right choice for you. Now, I want to talk a little bit about an example before we have Alice and have a conversation with me about her experience, just to give you an idea as to what she was starting with. So Alice has painful diabetic neuropathy. You can see colored in on these diagrams that where she had pain, burning, and numbness was really from the feet all the way up to past the knees. She's used at Nevro HFX for over 3 years to treat her painful diabetic neuropathy. Right now, when you ask her where she feels pain, pain sensation, burning, and numbness, you can see colored in. She doesn't have any of those symptoms. She's a real success for this. And that's one of the things that I think is a real opportunity to have that to maintain. And so I'll ask Alice to join us. Alice got a real joie de vivre. She really was in a position where diabetic neuropathy was limiting her ability to do the things that she wanted to do, and she's going to tell us about all of that herself. Alice, thanks for joining us.
Hi, how are you?
I'm great. Glad to see you, and thank you for being here to share your experience. Why don't you tell us what it was like for you to have painful diabetic neuropathy before HFX?
Okay, it started mild, and it kept progressing till it was really excruciating pain that I would say would not let me do anything. I was limited to anything that I can do. I couldn't sleep, which was up all night, turning, tossing. Living with this neuropathy was living on a recliner, on the sofa, in my bed. I didn't even have a life. I mean, the pain was really excruciating. It was numbness, burning, tingling. I mean, it was really bad.
How long had you had diabetes and then before you were diagnosed with painful diabetic neuropathy?
I started with diabetes when I was 46 years old. That was in the year 2000. And I've had it now for 22 years. But I didn't get neuropathy until I would say 2015 or 2016 was when I really had it bad. And that's when I came across, somebody spoke to me about diabetic, the Nevro stimulator for my diabetic neuropathy. And that's when I did my homework. I looked it up and I says, I'm going to do it. I did the 7-day trial. And for the first time in I don't know how many years, I was able to sleep all night long. And for me, that's huge.
That's wonderful. Had
Yes.
you a bunch of other things before the stimulator? What might have helped a little or not helped so that you'd already tried?
Well, they prescribed me Lyrica, gabapentin, Cymbalta, but none of that worked. Believe me, none of it worked. So there was nothing I didn't try. Every time a doctor would say, let's try something new, I remember they gave me an ointment, but so that I can put on my feet. That didn't work.
So it's one of those things where then it sounds like the temporary test trial really made a difference for you. So
yes, I did the trial, and like I said, I was able to sleep all night. That week, I had so much fun with my grandkids, with my family. I was able to walk. It was like, it went away. The first time they put it on, the pain went away 100%. I had no more pain. And after that, I got the implants, and my whole life has changed. I'm able to do so many things. Like, I love traveling, cruising, and I have a beautiful family that now I can enjoy. Diabetic neuropathy had taken over my life, and I didn't have a social life. I couldn't do anything. But I can tell you that after I got the implant, my whole life changed to being a happy person, to be able to sleep. Tell me what I can't do. There's nothing out there that I cannot do now. And who did the change was getting the implant of the Nevro stimulator. It made the change in my life. It totally changed my life. And one thing I want to say, if you're living with diabetic neuropathy, you don't have a life. There's nothing you're living in a couch, on a recliner, on your bed. There's nothing you can't walk. You can't do anything. So I'm going to say that this changed my life.
So before you did the temporary test trial, were you concerned, have any kind of concerns or hesitations? Did it seem strange to think that you were going to have a a pacemaker device, something that was metal with a little computer, or there was a procedure or anything like that?
Well,
You?
I'm going to say that when you're at the stage where I was so desperate. I mean, I would have tried anything. I wasn't scared about getting a device in my back because I went online and I went and I said, if it worked for your lower back, I mean, I know it's going to work for my neuropathy in my legs and my feet. I couldn't do anything. I was so limited. I was also always in a bad mood. I was depressed. I mean, if you are where I was at, you're going to try it. And you know, the best thing about neurostimulator is that they give you a trial. So if it doesn't work, then if it works for you, then you go forward. If it doesn't work, I guess, everybody's different. I'm speaking about my experience. For me, it took away my pain 100%. And if I'm going to say this, not only did it help my feet and my legs, it helped my lower back. I don't get injections in my lower back anymore. That was another thing I was doing for years and years, getting injections. I don't have to take pain medication for my lower back or I don't take any kind of medication. And I'm going to tell you this, if you had the pain that I had, you would go forward.
Mm-hmm. So tell me a little bit about the procedure, the day that you had the implant done. The temporary test trial was great. And then they took the temporary wires out and you had to wait a little bit of time.
Yes, a couple of weeks.
Yeah, I bet you missed it then, didn't you?
Okay, I waited a couple of weeks. I did know, they told me that I could not bend. There were some things that I needed to take care of myself so that it would work and the leads wouldn't move. So I did. I got the implant. I was a week with some surgery pain, but I did not have my pain in my legs or my feet. So that was a plus for me. I would take medication for my surgery pain, but I didn't have pain in my legs or my feet. So I'm going to say, after you get your implant, it would take at least 7 to 10 days. You're not going to have any pain after that. And then, of course, it's the healing process of the sensor that you have in your back. Of course, you need to take care of yourself for a couple of days, but it was worth it because not having no pain at all for me was a plus. And what I'm going to tell people that are going through the pain that I had, don't let painful diabetic neuropathy take over your life. If there is something out there that's going to work, it's neurostimulator. And it worked for me. And I would say, even if it wouldn't have, like, let's say, take away 100%, it was still a plus because I couldn't live. I mean, I didn't have a life. Now I travel. I had on my bucket list, I had a Jeep that I always wanted to get a Jeep, and I got it. And they asked me, how could you get on there? I says, why not? I mean, I have no pain. So I am a happy person. And you know what? I am so grateful that Nevro did, do what they did in my life, giving me my life back. And not only me, my family, my kids, I mean, they're all happy because, I can do what I can do now with them that I couldn't do before.
Since you had the implant procedure. So yes. Have things changed much in terms of how you feel about the pain or in terms of how you use the HFX device in your daily life?
Okay, I have that on my back. You don't see it, you don't feel it, it's there. And I know it's there because it's doing what it's supposed to do, take away my pain. I don't have pain. But it's there, but you don't know it's there because you don't feel it. I mean, when it's giving me stimulation, I wouldn't know when it does, but it's doing it's taking away my pain. And it's there, but you can't feel it. You don't see it above your clothes or anything. It's a very small device that I have on my back.
Yeah, and it's underneath the skin. It's completely
right. It's on, yeah, and I have it right on my waist level, and I can sleep on my back, on my side. It doesn't matter because after your healing, that it heals, you can sleep, it doesn't matter, on your back, on your side, because you don't feel it, and it's just there doing what it needs to do, taking away my pain.
So the HFX device is rechargeable. So
Oh,
you
yes.
have to use a little charger over the skin to put the power back in through the skin.
Right. Okay, and I'm going to talk about that.
Yeah, how does that work for you? Okay,
I charge, this is me, I charge every day 15 minutes while I watch the news. Or maybe if I don't watch the news, just a program. It charges, for me, it's 15 minutes every day, but I've heard, because I've spoke to other people that have it, and they say, oh, I charge every 3 days, or I charge once a week. Everybody is different. The pain everybody has is different, in the sense that maybe you need more time to charge than me, that I go 15 minutes. I mean, this is something that you work with the care team. They will tell you and guide you. And I'm going to say, after I got my implant, the care team that Nevro has, they're excellent. I would call them, or they would call me to see how I was doing. And everything was always, I would always get a call back if I left a message, or they helped me through my healing process. And like I said, they would call me to see if I needed to change, because maybe they thought that, because they took my pain away the first day. So I didn't have to be changing programs, because there are several programs that Nevro does have. But everybody's different. Everybody is going to get, maybe be on a like right now I'm on 2.4. But if you was to be on 2.5, it doesn't mean that you have more than me or less than me, because everybody's different. The way they program it is the way your pain is, what kind of pain level you have, or where your pain is more, is how they'll program it. But as far as charging, look, if something's going to take your pain away, and all you have to do is charge 50 minutes a day, for me, that's nothing.
Mm-hmm. You've been an ambassador, and I can tell your passion about trying to get the message so that people who may be in a similar circumstance will have the opportunity that you've had to have such a change in being able to take your life back from PDN. But talk to people about this. What are the kinds of questions that you hear most often about HFX, and what really surprises you? Or surprises them about what they hear when you're telling them about the HFX experience?
One of the questions they ask me most is the healing process. I think they're scared. How long will it take for me to heal? That's one of the questions they ask. Another question they ask about, does it hurt a lot? I mean, after you get the surgery, the implant, and you already, like, for instance, if I already healed, will I still have pain? I was telling them about the care team. I would tell them about that you will be working with a care team so they can put you at the program that you need. That's going to work for you. Another question they asked me a lot was I scared when I took the decision, because that's a surgery? And I said, look, if it was going to take my pain away and it was going to change my life, for me, for me, it's not important. What I'm going to tell everybody out there that wants to have a change in their life, and they want to live a better life, a happy life, a social life, being able to be with your grandkids, your family, your friends, if this is an opportunity that you have, do the trial. I mean, the trial is not a big surgery. And if that works, then you're a good candidate. And you're always going to remember what I said. Try it, because it's going to change your life.
When I'm a neurosurgeon. I do a bunch of operations, and this is one of the few operations that we can do a test drive for and have some idea that what we're going after in doing the permanent implant is probably going to help. The best predictor of what you get long term is what you get during that temporary test trial. I can't test drive doing surgery on somebody's slip disc in the same way that I can.
Yes, but it's what I tell everybody, doing the test, the trial for me, it's huge. It's an opportunity they're giving you to see if it works, you know. And you don't get this with anything else. And like you said, if you have the opportunity to do the trial and it's going to work, it's going to change your life. That's huge. For me, the most out of everything after I got, besides taking the pain away, for me, the most important thing was that I was able to sleep at night. If you're able to sleep, you're going to get up that morning with energy, able to do so many things, you know, versus what I was doing before. I would get up in the morning and I didn't want anybody to look at me and don't even talk to me and always in a bad mood. That's who I was before. My family, after I did the trial, they went and they says, you know, they even told me, God, you have changed, because I was able to do things I couldn't before. I was a happier person, you know. You know what it is that if you can't walk, it limits you to so much. If you can't walk, you can't go shopping. Your chores in your house. It was nice having people to help me, but you know what it is that you can't do nothing. That's how I was, with a lot of pain all the time, excruciating pain all the time. That's who I was before. But now I'm a happy person. I love myself for who I am now. And I'm enjoying, I don't know how many more years I've got left, but I'll tell you what, I am a happy person. Thanks to neurostimulation.
Well, I'm delighted to hear it and to hear you share that. And thank you for sharing that with our guests as well. But before we wrap up, is there one last piece of advice that you would want to share with somebody who's thinking about HFX?
Well, the only thing left I have to say is don't let the diabetic neuropathy ruin your life. It's not really running, it's ruining your life. You know, do the trial, try it. And you're going to see the difference in your life, that you're going to be able to do all the things that you wish. Because, you know, this is a time where we retire. Oh, I'm going to do this. I'm going to do. But guess what? If you have diabetic neuropathy, you're not doing anything, you know. So what I can tell them is do the trial. I mean, go for it. And I'm sure that your life is going to change for better.
Thank you so much, Alice, for sharing so passionately with me. I love hearing you talk about this so much.
You're welcome.
So one of the things I want to just tell everybody is sort of, how do you start a conversation like Alice had to get the ball rolling? Unfortunately, even though people with diabetes may see a lot of clinicians, pain may not be something that you talk about. If you're spending a lot of time talking about foot health or glucose control or other factors, you may not have that opportunity to talk about just exactly how big a role pain is playing in your life. So it's important to try to bring that up and to act on behalf of yourself the way Alice described. How long is too long to just live with that pain? Well, if it doesn't go away with medications, if the side effects are getting in your way, if you really are frustrated to the place where pain is dominating your life and you can't do the things that you want to do, it can be some of the things you heard from Alice. It keeps you awake at night. You're not able to do the work and you're having to try to cut back or ask for help or even consider taking time off of work due to your lack of ability to keep up, not being able to walk those distances, and that limits your ability to do the things in life that you're happy to do. And if those are the sorts of situations, then that's where having a conversation with your doctors is important. We're going to open things up for some questions, and so we just want to give you a chance to have an opportunity to ask me some questions, since this is an open opportunity.
Great. Thank you, Dr. Petersen, and thank you, Alice, so much. Just as a reminder, on how to submit those questions, if you click on the Q&A, then you can, there's the field, you can type in your question right there and either hit the blue arrow, or on your phone, you can hit return or enter on your desktop keyboard. A couple questions we've got so far already, so we can kind of jump in is, Dr. Petersen, does this treat other types of neuropathy? We've been talking about painful diabetic neuropathy, today. Back pain came up a little bit, but yeah, if you could talk about, can it treat other types of neuropathy?
So the research that we did looking at painful diabetic neuropathy is the largest scientific research study done with the use of a spinal cord stimulator at all. And so when we talk about the science that's supported to get FDA approval and those sorts of things. It's really focused on painful diabetic neuropathy. That's where the strength of our research is, and that's what is approved by the FDA for neuropathy treatment. But chronic back pain related to failed back surgery syndrome, complex regional pain syndrome, and a few other conditions have also been approved by the FDA for treatment. When it comes to other kinds of pain, there is some research out there on those, and it would really be something to talk to an experienced pain doctor about so that they can understand the symptoms that the patient is experiencing and understand whether this may be the right solution or not. And so I would recommend that that's a very tailored, specific, individual conversation about that specific patient's circumstances.
Great. Thank you, Dr. Petersen. And just to facilitate, make it easier for anyone, if there is anyone with chronic back pain in the audience, we do have our sister website, nevrohfx.com, but we'll include that link in our follow-up email that we send out, so you don't have to worry about writing that down. One other question is, we talked about, who's a good candidate for Nevro HFX at this time, but what if maybe you haven't tried prescription medications yet?
Mm-hmm. So, I think that goes to what I was saying, is that I think it's very important to remind the doctors that are part of your care team that pain is an important thing, and that is something that is a high priority to treat. There are medications that can help. And again, if a medication can possibly make a difference, it certainly makes sense to try that. So the first thing is to find the time that your doctor can pay attention and hear, I have this burning pain that keeps me up at night. Alice does such a beautiful job of describing what she experiences, and she just fills the room in explaining it. And so if you make an appointment with your doctor to say, look, I may have a really good A1C, I may be really doing well, but I have pain that is stopping me from doing what I want to do. How can I get this taken care of? The first steps may be a few medications. Usually we know within a few months if those medications are going to help. And if those medications haven't helped, then Nevro HFX may be the right thing to follow after that.
Great. And there's a question related to that, which you've just partially addressed, but is, how bad does your pain have to be, to use this, right? You talked about, if it's impacting your quality of life, but is there anything else, you'd add to that, for that conversation?
So pain is such a subjective thing, because from the outside, you can't tell that necessarily something is wrong with somebody. A lot of people will just sort of suck it up and get through the day because that's what they have to do. And they'll just try to ignore it the best they can until they have to put their feet in an ice bath when they get home. It really does have to do with how exhausting that is, how much can a person stand. But when you ask somebody to rate their pain, typically we are looking for people who have constant pain that is 5 on that 0 to 10 scale or higher. As I showed you and briefly in those numbers, the average from our research study was an average of 7.7 pain. And some people will have good days and bad days, and that's why we say an average. And they may have pain that is sort of always a 5, and then it surges to 8s and 9s. That's just a relative way of us sort of trying to understand what the intensity and severity is. But ultimately, person themselves really has the best sense of how they're being impacted. And if you're not sure, often friends and family who know a person very well can watch and say, hey, you're just not yourself anymore. You're not fun. You're cranky. What's going on? And if it's all related to the fact that this pain is unbearable, then that may be the right thing. But everyone has a different threshold for pain. And depending on what other things are going on in their lives, they may say, you know what, my pain is bad, but right now I have a family member who's sick, and I don't want to pay attention to my own problem because something else in my family is more important. I hear that a lot, and I hate to hear that people are putting things off for themselves, but that's how life works. And so it really is about prioritizing oneself and one's health and their longer term overall well-being, because if you can get yourself feeling better, then you sleep better, you move better, and you're able to take care of those around you better as well. We have to invest in our own instruments as the tools of taking care of those in our families and our communities.
Yeah, absolutely. Thank you. Another question that came up, and again, it's kind of, there's been so much information presented, and Alice did it, talked about how great, the trial phase is. But maybe could you talk a little bit about kind of what's involved, in the trial phase of, are people going to home the same day, kind of how long, what does that look like,
Yeah.
during that time?
So the temporary test trial is done either in the physician's office or sometimes in a day surgery procedure suite. And with a little bit of numbing medication, a needle is threaded into the spinal canal, and then the little electrode wires are threaded through that into the position where they will influence the nerves within the braid of the spinal cord. That needle's removed, and there's just a bunch of tape over everything to hold the wires in place, and a little external temporary test unit that's taped over the outside of the skin. A person goes home from the procedure, and it's probably no longer than 2 or 3 hours total from checking in to leaving after the procedure. And the procedure time itself is a very small amount, about 30 minutes or so of that time. Then they wear the device at home. There's a lot of tape around everything, so you do the best you can trying to approximate with that, but it allows you to try to move and stand and walk and go shopping, things like that during the week, to get a feel as to how this really would work if you had the device permanently. Then at the end of that temporary test trial week, you come back to the office. All that tape gets removed, the temporary wires are removed, and there's just typically a little band-aid with the little spot in the skin where the wires came out. And like Alice did, waited a few weeks to then have the permanent procedure to put the device in. And then this time, instead of the wires coming out to a temporary external controller unit, the wires are run under the skin, and when the battery pack is situated about an inch under the skin in the buttocks area, and that's what provides the power and signal for the system.
Great. And you kind of went into part of the next question, but is, about how everyone's different, every individual's different, but about how long would be the recovery period from that permanent implant?
So, so the biggest worry that I have is for healing, especially I know some people are worried with wound healing in patients with diabetes, but if people have fairly tight glucose control, the risk of healing issues just because of having a diagnosis of diabetes is not elevated over people without diabetes. But the other piece of that is that the wires are balanced in the spinal canal, and they can shift and move a little with extra movement. So we ask people to take it easy in terms of vigorous activity for about a month or so as the tissues are healing in and scarring. But I'll let people shower as normal 2 days after surgery, and they're just a little sore from the procedure. A little bit of pain medication, ice pack, heat, those sorts of things help to take the edge off. And generally the soreness is gone within a few days to a week or so. And the stimulator, just like Alice described, is starting to work even in the recovery room at a low level. And then we start to adjust and adapt, working with the neurocare team.
Great. And, we talked about, having tried maybe prescription medications and the level of pain. But is there anything else that would make somebody maybe not a good candidate, for HFX, like A1C or, yeah?
Sure. So every candidate is individual, and so the safety for a procedure is something that should be part of a detailed discussion with that specific pain clinicians for that specific patient. There's a few things. One is, every so often somebody's on blood thinning medications. It's not safe to do any kind of surgical procedure and heal a scar when have your blood thinned. So we like for people to be able to come off those blood thinning medications for the time around surgery so that we can do the procedure safely. That's one thing. People who have other risks related to having a surgical procedure or potentially to receiving anesthesia may need some special consideration before undergoing a procedure where they're going to receive some sedation or other medications. I mentioned the risk of healing, and so we want to make sure that people don't have a problem with unhealed wounds. Typically, if somebody has a foot ulcer but it's clean and not infected, that may not be a reason to avoid having a procedure done, but it would certainly be something that we want to be thorough in terms of making sure that it doesn't compromise somebody's overall health.
Great. And what if somebody has a pacemaker already?
Yes.
Yeah.
Well, they just get to be a double bionic by having device. So there's the devices are fairly well separated. Typically, the pacemaker will sit in the chest, and the battery pack unit for the HFX is within the buttocks or the flank area on the back side of the body. And so they're not in a place where things interact. And so that on its own is not a reason to avoid having a stimulator with HFX placed.
Right. And, somebody has asked, if they already have an SCS device, but it's not really working that well for them, could they still get this?
Yeah, so depending on the kind of device that already exists and where the electrode wires are and things, there may be an opportunity to either place a new device or to even just switch the battery pack. And that would be something that you should talk to your pain surgeon or pain clinician about in terms of what the opportunities are for that.
Great. And, speaking of other devices, what's the difference between, Nevro HFX's device and then other devices?
Yeah, so there are about 6 different companies that manufacture spinal cord stimulator devices, and that's what the HFX is within that category. But it has its own very unique patented way of delivering the stimulation, as I described it, as sort of a way of jamming the signal. So the device works at 10 kilohertz, which is a very high-pitched frequency that's patented. No other company can deliver that specific way of interacting electrically with the spinal nerves. And so what that leads to is this very special way of blocking those pain messages from being relayed and getting peace and quiet from those pain signals. So what that ultimately means is some of the companies will create a stimulation where people can feel a vibration or a buzzing, a fizzing, or a tingling, and those typically happen at lower frequencies. You think about something like, again, when I'm talking about frequencies, think about the bass versus the treble on a song. So your really low throbbing, thumping frequency, or even the mid-level tones of singing voices, those are all frequencies that we can perceive. And the issue with that is when somebody has painful, creepy crawling, vibrating, and burning feet from the paresthesia that comes with painful diabetic neuropathy, adding an additional vibration from the stimulator device on top of that can really be worse instead of better. It's uncomfortable, it fluctuates, it's too much, it's too little, it actually doesn't feel good at all, and it gets even worse when people try to lie down and get quiet at sleep. The difference between what you experience with those lower frequencies and what we have with the 10K frequency is the difference between a regular whistle and the high pitch of a dog whistle. The noise still happens because the dogs can hear it, but it's beyond the pitch of what we as humans can perceive. And so when you get the impulse through the Nevro HFX device, it's at such a high pitch that we don't perceive it. We don't perceive the tingling or vibration or anything else that's perceived at the lower end of those frequencies. So what that means is that there's no tingling. There's none of this paresthesia, vibrating, humming kind of related to the device. You just know that it blocks the pain and the pain is better. And what that translates to is that people have pain relief both in the daytime and the nighttime. It's something that is not subjective to a specific type of position or any sort of thing else, and it allows for a lot more versatility in terms of activity, and it seems to mean that we're getting a better level of pain relief for people who have the burning and tingling, creepy crawly kinds of pain that come with PDN.
Great, thank you. No, just a fun, on to okay, I'm living my best life question is, can I swim with the device? Or maybe it's getting a little chilly in a lot of climates right now. Could somebody go in a hot tub with it, right? Assuming after, a healing period and everything.
Yeah. So I ask people not to get in standing water while the scars are healing. But once the scars are completely healed, absolutely. I have patients with an HFX device who've been scuba diving. I have had people who've been backcountry kayaking, where they had to carry the kayak between portions of the creek that they were kayaking in. I mean, There's really nothing in terms of activity in the longer term that is limiting when things are healed up. The device is certainly something that people can swim with or do anything like that. It's completely buried under the skin. There's nothing that is an external component. The charger communicates wirelessly, so don't have that around water while you're out swimming.
Yeah. Yeah. You don't need that with you. Yeah. All the time. Yeah.
Charge when you're done swimming.
Yeah. Yeah. Exactly. So we heard from Alice that she felt relief, right away. But generally, for a lot of people, right, how long after the implant, will they feel relief?
Well, so there is a specific way that we follow to turn the stimulation on, and it follows sort of a recipe of do this on day 1, this on day 2, do this on day 3, and then as we're following those steps, it's because we don't expect that everyone will exactly click in with their best pain relief on the day 1 with step 1 or step 2 of that programming recipe. So we have to find what sort of the sweet spot where the best interface is between the HFX device and the patient's own nervous system reaction. And so it takes a little bit of time to work through that. Usually it's the difference between having okay pain relief and having really good pain relief. But we try to start, especially because we've learned something about where that special sweet spot might be during the temporary test trial. When we have the permanent device implanted, we try to go back to that same spot again because we've learned a little bit about where that spot might be.
Great. Is there any age limit?
The device is FDA approved for adults. So that's over the age of 21. But there are instances where we have had younger patients who've needed a device for nerve pain related to, say, tumor surgery. I've done a few technically not approved by the FDA. And then, obviously when you get to very old patients who may be a little bit more frail, they may have additional medical considerations where you really need to kind of decide, is this a good next step or not? But I've also had patients who are very robust at an older age and they're wonderful candidates without a lot of risk for surgery. And the main thing there is if it's going to make a change in somebody's ability to function and improve their quality of life, then it's certainly something that I would want to consider for them.
Great, thank you. And then, can you drive with the device, once you have it?
Absolutely. So that's something that again goes with the fact that you have this tingling sensation. You can imagine that if you're feeling a tingling from what the other company devices, all of a sudden you get a surge or a fizz or even like a little jolt, that might cause you to shift the wheel or something. So those companies have a recommendation in their instructions that says do not operate your stimulator while driving because they don't want that jolt to cause a traffic accident when a driver would experience it and maybe flinch in some way. Because you do not feel anything because of the 10K patented frequency, there is no restriction on driving with the HFX device.
Thank you. And then, on that note too, what's the long-term use of this look like, right? So charging every day, or charging on your schedule as mentioned, but anything else just longer term, or how long, right? Do people, get relief from this?
Right. So our research looked at patients for 2 years within the research, which is a long time, but, we know the patient who has had the HFX device the longest was for back and leg pain and had the device working well for 13 years for back and leg pain using the same device, charging it on a regular routine, didn't need surgery to switch it out, has had access to MRI scans as needed during that time. All of those things are part of the consideration on things. So I hope that we're going to see, like Alice, who's had 3 years with improvement with PDN, I hope Alice is going to have many more years than that also. But we just need to give it time because we've only been able to start using it recently. So while the durability is there in terms of how long HFX devices have been used for PDN, we can say right now we know that some of the patients in the research study have made it longer than 2 years and continue to use their device like Alice to get good amounts of benefit. And I did want to comment on MRI. None of the spinal cord stimulators from any manufacturer are MRI safe. But they are the sort of thing where under the right settings, if the MRI scanner meets a certain checklist and if the patient device meets a certain checklist, that an MRI can happen under those proper conditions. And that exists as well for the Nevro HFX device. If the device is read under the proper conditions, then an MRI of any body part can be obtained. And you just have to work with the clinician that is ordering the MRI scanner for you to make sure that you're having that scan done at a facility where the MRI machine meets the checklist, and also that the device within the patient meets that checklist. And so I, as a neurosurgeon, do a lot of MRIs. I look at spines and brains, and those are important for me to see on scan. And so that's something that I want to make sure that I have that access for my patients. And I have extreme confidence that I can get that using Nevro HFX for my patients.
Thank you. Well, there's a few questions around insurance and coverage, so I will go ahead and take that one. And understandably, there are those questions, but yes, HFX is covered by all major insurance plans, including Medicare and Medicare supplemental plans, and as well as I mentioned Medicaid and military or TRICARE, VA. A key part of kind of the steps to to getting relief with Nevro is one, we mentioned we'll cover the next steps in the next slide, and we wrap up here pretty soon. But when you're taking that assessment, you're submitting your contact information, and our Nevro HFX care team is reaching out and helping you connect with a local doctor that's experienced with HFX. Scheduling that consultation with that doctor is one, not only really their opportunity, the time for them to review your medical history, everything that you've tried does it look like you're really a good candidate this time for HFX? That's also when they'll, deep dive into looking at, your specific insurance, coverage, and what is this going to look like, for you. So, because those plans, differ, state by state, individual, plan by plan, and individual level of coverage, person by person. So really best, understanding that, the exact details of that in those consultations, but it is covered under, most major insurance plans and covered by Medicare supplemental plans. One other question that has come in that I know we're running out of time, but I want to get quickly in is somebody mentioning, will this help their neuropathy in their hands?
Yeah, so the location of the electrodes to treat the lower extremity foot diabetic neuropathy, which is what we did the research for, and what the FDA approval is based on, is our research. Those are sort of at the level of the sternum or the bra strap, at the T910, thoracic 910 level. So that is a place where the nerves from the lower extremities come in and enter the braid of the spinal cord. The upper extremities, those come in from the cervical spine up in the neck. And so that has not been approved by the FDA, but there is research to suggest that it can be effective in that location as well. And it may be something that can be beneficial, and you'd have to talk to your own doctor about whether or not you would want to pursue that as an option. But it's certainly something that I talk to some of my patients about.
Great, thank you. And one last, there's so many questions. I would love to get through them all, but one last that I know that is really common is, will this take care of just the pain, or also if I'm experiencing numbness, will the feeling, and then we talked about that a little bit, but I think it's maybe worth touching on again.
Yeah, so in our research study, we saw that about 60% of the patients who had HFX as part of the research had an improvement in their neurological function, either in strength, in reflexes, or in sensation. And the majority of those improvements were in sensation. And so we're still trying to figure out why that is. But part of what may be happening is just the fact that the burning is so intense that any residual sensation that might be there is so drowned out. I think about it like if you're in a nightclub trying to have a conversation and the music is too loud, it's way different than if you can turn the music off and actually just hear the person having the conversation with you. And so we found some people in the temporary test trial, within a day or two of starting that temporary test trial, their sensation was changed. And I think in those situations, it's because they had more residual sensation than they could tell tell when the pain was there. And by decreasing that pain, like getting the nightclub music down, you could tell what was still there. But we also had other patients who may not have noticed much change at first, but then it was definitely better and better over the course of the 24 months. And so I do think that there's something that can help in terms of sensation using this, and hopefully going to be involved with more research looking into this to show it with even stronger science.
Well, thank you, Dr. Petersen. And I know we're just right at time, so I do want to just, reiterate for everyone. Okay, so like this all sounds great and interesting, and I'd love to learn more. Like, what do I do? So you can head on over to hfxforpdn.com. You can answer a few questions there in the assessment to see, does it look like Nevro HFX may be able to help you at this time? And if it does, then you can, submit your contact info. Someone from our care team will reach out. They can help answer any individual questions that, that they can help with, and that don't have to maybe go to, specifically a doctor. But then they can also, most importantly, help you find that HFX trained and experienced doctor that's near you, based on your zip code. We're going to send out this information in an email along with a link to the recording within 24 hours, as long as it takes us to kind of get it up and send it out. So that information will all be in there, including, if you happen to stumble onto this and, you're experiencing chronic back pain or a different type of pain, then you can link over to our sister website, nevrohfx.com as well. But I just wanted to thank you, Dr. Petersen, and Alice, you as well, for your time, not just for today, but obviously we've been preparing for today's presentation as well. And also, especially, I want to thank all of our attendees, for joining. You are why we are here. And so thank you for your time.
Thank you. Bye-bye.
Thank you very much.
Thank
Bye,
you.
everybody. Thank you.
Bye.